Thank you guys so much for being here today as we give you an update on our fight against COVID-19 in the state of Oklahoma. We'll be talking about how treatment options are improving. One of the ways is a drug called remdesivir. We're sending more of this to hospitals all across our state. Also, fewer people are needing to go to the hospital, and we'll give you an update on that. We're also here to talk about how we still have hospital capacity and PPE if the situation changes. I'm here today with Dr. Lance Frye, our Commissioner of Health, Dr. Doug Druvitz, an infectious disease expert at OU Med, and Dr. Mo Som, the Chief of Staff of OSU Health Science Center, Medical Center in Tulsa. And you'll hear from each of them in a few minutes. Right now, Oklahoma, we have 516 people in the hospital across the state of Oklahoma. On March 30th, we had 560 people. And that's when non-essential businesses were closed, and for the most part, Oklahomans were working remotely. We had issued 30 different executive orders. Now we've been fully reopened for more than 3 months, and that trend, I'm pleased with that trend in hospitalizations that have remained flat and a little bit of a decline since the March 30th time period. We've also made great progress in treating this virus. That's thanks to the hard work of our doctors, nurses, all of the different medical professionals. I know they've been working long hours in really tough conditions. I want them to know that as their governor, as on behalf of all of Oklahoma, we're so proud of our health professionals, all the hard work they're doing to protect Oklahomans. But Oklahoma, hear me on this. Just because doctors and nurses can treat you doesn't mean we shouldn't all do our part to slow this spread. As schools are reopening, we still need to take personal responsibility. It's up to each of us to protect our families, our neighbors, our communities by washing our hands, watching our distance, and wearing a mask when we're around others. It's also very important that we protect our most vulnerable populations. Be careful if you're going to be around someone who's over the age of 65, who has any kind of compromised immune system. Because when you look at the stats in our state, for example, August, 85% of our deaths in the month of August were over the age of 65. Almost 100% of them have comorbidities as well. So following the 3 W's is the easiest way to keep everyone healthy and to allow our kids to be in school, in their classrooms. With that being said, here's an update on our hospital situation. A drug called remdesivir is really starting to show promising signs. It's helping people. It's an antiviral drug that's been shown to lessen the effects of COVID-19. You can take it through an IV, and it's only for people that are really sick in the hospital. Actually, a report from Baylor Scott White Health shows remdesivir has made COVID patients 62% more likely to recover. And I'm pleased to tell you now there's an ample supply of this drug in the state of Oklahoma. The U.S. Department of Health and Human Services sent us 810 vials this week. We're getting those out to hospitals all across our state. We have another 300 vials going to be shipped to Oklahoma next week. OU Medical Center in Oklahoma City is one of the recipients. We have those on their way now to Norman, McAllister, Tahlequah hospitals, as well as others around the state. We've also removed some red tape and are allowing hospitals to request it based on their needs, and I'll let the doctors tell you a little bit more about that. We're seeing positive trends. Also, something else I'm very pleased with, we're seeing some positive trends in the percentage of people who need to go to the hospital. At one point back in April, 25% of our active cases, and it's something that the health department and myself really track closely, is the active cases in the state of Oklahoma. Currently, we have about 11,000 active cases. That's somebody that's currently positive within the last 14 days. So in other words, they haven't recovered. We have about 60,000 or more Oklahomans that have recovered. But on the active cases back in April, 25% of those active cases were in the hospital. That's gone down all summer. It was less than 10% in the month of August. And now for the last 3 weeks, it's been actually below 5% of our active cases are having to be hospitalized. These trends are encouraging, but we have to continue to stay proactive in our responses. We have more hospital capacity and more PPE if the situation changes. And I'll ask the Commissioner of Health, Dr. Lance Frye, to give us an update on some of the hospitalizations, some of those treatments as well. So, Dr. Frye.
Thank you, Governor. It's great being with you this morning and being able to share updates on Oklahoma's continued response for COVID-19. Let me begin by saying I'm encouraged by the actions taken by Oklahoma's local leaders to adopt important guidance that helps guide Oklahomans in protecting themselves and those around them. As I've said before, while I'm encouraged by the tremendous response of Oklahomans, we must remain vigilant. The healthcare providers around our state are truly on the front lines of this battle, and I'm amazed by their diligence and their expertise in treatment. And they've been keeping our mortality rates, our percent mortality rates in Oklahoma less than half of what they are nationally. We're at 1.3% in Oklahoma, and nationally they're at 3%. Hospitalizations have largely stabilized in Oklahoma. As you heard the governor say, we've remained between 500 and 600 hospitalizations a day consistently for quite some time now. Age-specific hospitalization rates have remained stable over the past 3 months. And while we're seeing an increase in active cases, the percentage of those cases that require hospitalization is decreased. The percentage of active cases requiring hospitalization has remained below 5% for 3 weeks. For context, at its peak, 25% of active cases were being hospitalized. So 1 in 4 people were infected were having to stay in the hospital. Low hospitalization rates mean lower COVID-19 specific demand on our healthcare system. Hospital capacity and PPE availability remains strong. Our average length of hospital stay has remained around 5 days since July. While all of this is good news, we know that this evolving situation will continue, and we need to monitor it very closely. There's still much we must do to stop the spread of the virus. We also know that flu season is coming, and symptoms for COVID-19, including fever, coughing, shortness of breath, can be very similar to that of the flu. So we need to ensure that our healthcare system can handle both, which means we must continue to remain diligent about preventative measures, such as masking, social distancing, etc., which can help the spread of both the flu and COVID-19. We know there's no silver bullet, but we are optimistic. Some treatments are showing great promise. We're encouraged about vaccine development and look forward to sharing more very soon on Oklahoma's distribution plan. I'd like to turn it over to Dr. Druvitz to speak about improvements that he's seeing in treatments. And Dr. Druvitz, thank you.
Thank you, Commissioner Frye. Thank you, Governor, for asking me to be here. And thank you all for being here and showing interest in what we're doing in the healthcare arena for COVID. So the world is changing. First, there was the pandemic, and this started, as you recall, sometime in December, perhaps a little bit before that, and then rapidly globalized. After globalization, then came the realization that this was a serious infection that can have serious consequences for many people. particularly those who are ill enough to find themselves in the hospital. Now we are using hard-won experience that was gained in the spring to improve outcomes of people who are hospitalized with COVID. And we are looking forward to having better treatments and an effective vaccine. Right now, we are using antiviral agents such as remdesivir and anti-inflammatory agents like dexamethasone to improve outcomes. And as you already heard from Commissioner Frye, the crude mortality rate in Oklahoma now is under 1.5%. My recollection is that in the spring, somewhere around March, April, May, it was hovering around 5%. So that's a real change. And whereas this change in a good direction is multifactorial, one of the factors is that younger people are being infected, and these individuals often have a better course of disease than older individuals. There are also real improvements into treatment, and we healthcare providers are getting better. We have learned, there are new treatments coming out, and we are indeed improving. So we look forward to continuous improvement as we go forward, and we hope that we will continue to bend the curves for all Oklahomans in a favorable direction. And now it's my pleasure to introduce Dr. Mo Som, who is the Chief of Staff at OSU Medical Center in Tulsa. Dr. Som.
Can you repeat your name, sir? Could you tell
I'm
us?
Dr. Doug Druvitz. I'm the Chief of Infectious Diseases at University of Oklahoma Health Sciences Center.
Thank you, Dr. Druvitz. I want to echo everything that everyone's actually said here, from Governor Stitt to Commissioner Frye to Dr. Druvitz, as far as having to do our due diligence in order to make sure that Oklahomans are protected, which includes the preventative measures that we hear about so frequently, as far as social distancing, wearing masks when you're in public, and keeping your distance. As far as where we've come, we've really come a long way as far as our arsenal of treatments in regards to fighting the COVID pandemic. Dr. Druvitz and Governor Stitt both mentioned remdesivir. And so just a little bit of background, remdesivir actually has what we call emergency use authorization by the FDA. The FDA does not give emergency use authorization freely, and they give it in times such as this when we have very, very few treatment options and the need for medication is very, very great. Remdesivir actually got its emergency use authorization in about April of 2020. And the reason it got its emergency use authorization was because it showed that recovery can actually be at 11 days in patients who receive remdesivir in comparison to 15 days in those patients who don't. So that's a big deal when you're a patient that's suffering from COVID-19. Another trial that's actually come out and just had a recent press release was remdesivir plus baricitinib. Like Dr. Druvitz mentioned, remdesivir is an antiviral. There are two phases of this disease process, the viral replication process, and then also the inflammatory process, which you'll hear a lot about. Baricitinib is a medication that actually fights the inflammatory process. What they found was when you use remdesivir in combination with baricitinib, it actually reduces your recovery by 1 day, which is a big deal in these patients who are severely suffering. Same things that they've seen with Decadron or dexamethasone, which Dr. Druvitz mentioned also, which shows that in individuals who were severely sick with COVID-19, they have a 1/3 reduction in the mortality. When they're sick, requiring oxygen but not necessarily on mechanical ventilation, it actually reduces its mortality by 1/5. The other medication that has been available to us is something called convalescent plasma. So convalescent plasma also recently received emergency use authorization by the FDA. And we use all of these with caution. Remember, most medications have to be vetted months to years before they're granted FDA approval. The FDA recognizes the need for medication this time because of the COVID pandemic and the severity and the impacts that it has on our patients. And so having these medications being added to our arsenal to help the public, not just in Oklahoma, but nationwide and worldwide, is of extreme value. So I'm pleased, just like everybody else has mentioned, that we've had additional medications that we can offer to the public. I am pleased with the reductions in morbidity and the reductions in mortality, as well as the reductions in hospitalizations. And I agree and echo everybody. I think it is so multifactorial. The patient population that we're dealing with in the hospital, in addition to the additional medications that are available to us so that we can effectively treat our patients. And then I will turn it back over to Commissioner Frye.
Thank you, Dr. Som, Dr. Druvitz, and thank you to yourselves and all the healthcare workers out there for all the work they're doing in this fight against COVID-19. You've heard a lot of good news, and while we're very optimistic about this and very pleased with it, I just want to remind Oklahomans that they have to remain vigilant in this and continue to do their part in continuing to fight the battle against COVID-19. Right now, the distribution of cases in Oklahoma is still mostly in the 18 to 35-year-olds. That's the age group that we've seen the highest growth in cases in and the predominant number of cases. College students, please practice social distancing, wear a mask, wash your hands, and if you start to feel ill, please stay where you are. Stay where your housing is in your college area unless you feel like you're obviously to a point where you need to seek advanced medical care. Then go see your provider and they will take care of you there. But we don't want you to take this back to your communities, to your families, to your multi-generational families. While many of us have very mild symptoms, if we get this virus, it can be very serious to other people, as you know. So please don't take it back and spread it to our most vulnerable population. So Oklahomans, we must continue to do our part. Make sure we wear our masks, stay physically distant, and wash your hands. With that, I'm going to turn it back over to you, Governor.
Thank you, Dr. Frye. As you've heard today, Oklahomans can feel confident that the treatments for COVID-19 are improving. We can also feel confident that hospitalizations are on the decline, and the hard work of our talented medical professionals is really paying off. And again, I just want to thank the hard work of our nurses, our doctors, all the medical professionals for doing such a fantastic job of taking care of Oklahomans. But just to echo what Dr. Frye said, the best way to thank them is for us all to do our part to protect our state, and that's to wash our hands, watch our distance, wear a mask when we're around others, and make sure that we are protecting our most vulnerable population. So if we all work together, we're going to be able to keep our kids in school and keep Oklahoma open for business. So let me open it up to a few questions for myself or the medical professionals here. Yes, sir.
How is the federal government allocating the supply of remdesivir? Is it going to states that have higher hospitalizations, higher active cases? How's that working?
Let me take that one, Dr. Frye.
Well, I'm not sure exactly how they're doing that, but if it's typical with the other things that we've seen, they're sending it to places where it needs to be allocated, where they have the need for it.
There's a limited supply at the national level, right? So
yes. They've talked about that with the vaccine as well, that they would probably do it in a phased approach where they would send that to places that have more shelters, like where there may be wildfires or hurricanes, et cetera, to start off with, and then move throughout the rest of the nation. So,
what is the shelf life of the drug? How quickly is that be used before you jump in?
Do you know what the shelf life is? I don't either. We can find that out for you.
It's not short though, right? Like you don't have to use it for 24 to 40 hours.
For example, you can have at least 3 months supply. I'm here right now, that we so it could last at least that long. What do you attribute that to? I know it's probably a multitude of things. What do you attribute that to? And then, Governor, does that signal to you anything additional in terms of restrictions maybe needed anytime?
We've looked at it. It looks like it's mostly due to school reopening. Universities are the main factor. We've also had some outbreaks in different congregate facilities throughout the state, Department of Corrections, et cetera, but the significant number of them are universities.
We obviously look at all the data, and we also are focused on the hospitalizations, and with hospitalizations being around 516 and being a flat situation, we're monitoring that on a close basis. And if you think about it, this is something Oklahomans, I'd love for Oklahomans to know. In California, for example, we still have fewer cases in California per capita, and they've been shut down. So you've got to remember, Oklahoma has been fully reopened with no restrictions since June 1st, and the hospitalizations are flat, and that was what we tried to do in the very beginning. Yes, sir.
Flu season was mentioned, that is there any worry of a surge on hospitals and
Dr. Moe, you want to take that one?
So, good question. Anytime you have two viruses, it always makes the risk for hospitalization, severity of illness, and morbidity much, much higher. One of the things that we know when you start thinking about flu, the same precautions that we're taking for COVID-19 are the same precautions that we would actually take for influenza too. So if we're appropriately masking, if we're appropriately washing our hands, if we're appropriately social distancing, there is some argument to suggest that we'll actually be able to temper flu simultaneously. What we do know, and this is based on some of the knowledge that we actually acquired when we just went through this starting in January, is that individuals who are affected with flu concomitantly with COVID-19, they fare worse. And so is there a concern about it? Yes. Is there a concern that we could see a surge? Absolutely. But if Oklahomans continue to do what's been prescribed by the physicians, by the governor, by the commissioner of health, we are very hopeful that we can actually temper a surge and be able to adequately handle that. Right now, if you looked at the trends in the hospital, even practicing in the hospital now, you can see that we still have bed capacity. That doesn't mean that we do whatever we want so that we can fill the hospital. Really remember that preventative measures is what's going to get us through this entire pandemic when it's seen simultaneously with influenza.
You say worse, do you mean potentially more deadly by chance?
Yes, and that really depends on, again, remember the demographics that we're very concerned about. We're concerned about those individuals that are older than the age of 65, the vulnerable populations. Those have immunosuppressed statuses, and those who have multiple comorbidities. So the things that we look at, obesity, diabetes, hypertension, et cetera, et cetera. If those individuals get infected both with influenza and COVID-19, you're 100% correct, their mortality can be predicted to be higher just by the nature of having two infections simultaneously.
Commissioner Frye and Governor Stitt, I have a question for both of you. Yesterday, The Hill published a story that talked about an email that former state epidemiologist Dr. Wendelbo had sent prior to President Trump's rally in Tulsa. And he basically warned that it was going to be a question of not if people might die if they attended the rally, but how many people might die. And so I'm just curious if what he was talking about in the email, was that brought to your attention? And if it was, why was that not brought to the attention of the public?
Well, we look at tons of different data, and if you remember, epidemiologists, I had some predicting we'd have 5,000 people in the hospital. On April 1st, we had some predicting 30,000 deaths in April, and so we have to take all that information in. And we have to, do the best we can, and that's why we're transparent with all the data in Oklahoma. The other thing is, before that Trump rally, we were very clear. I told anyone that was over the age of 65 or that had any compromised immune system, they were safer to stay home and watch that event on TV. We had the event that was a couple months ago, and I can let Dr. Frye give you his comments on that.
I agree with the governor. I mean, we get lots of modeling, and so far the only thing that's consistent is it's all been wrong. But we look at all of it, we assess it, and then we give guidance based off of the information that we get, and we definitely gave a lot of guidance to everyone prior to the rally.
Commissioner, if I could ask you, the White House Coronavirus Task Force that's on your website from the 13th, the first recommendation was it says establish a statewide mask mandate. Where are you guys with that? Are you doing that or what?
We've issued guidance stating that we believe everyone should wear a mask and that to follow the guidelines from the CDC. We have not issued a statewide mask mandate that would come from an executive order from the governor. And the governor and I both feel that we're leaving that up to local communities to make those decisions on their own.
But Governor, isn't this from the Trump administration? I mean, I think you and the president are pretty close. You guys speak a fair amount. This is from his White House task force.
Well, from the very beginning, we make decisions based on the facts and the data here in Oklahoma, and not what we see on television, not what the feds tell us we have to do. And even when Dr. Birx was here in Tulsa, we specifically sat down with her, and she agreed that she believes that decisions should be made locally. So those reports are a lot of times just cut and paste sent around to all 50 states. And we have some counties that have had 0 cases in the last 7 days. And I've been very clear from the beginning that I believe a mask mandate is unenforceable. And I'm not going to mandate something that I don't think that you can enforce and violates some of the making someone in Western Oklahoma that has 0 cases wear a mask, I just think is not practical. But again, we believe, like Dr. Frye said, some of the local communities that have decided to do that, we applaud that. We think that's a local decision, and I'm not going to mandate that statewide because I don't think there's a one-size-fits-all approach to this virus. And then when I step back and we look at how we're doing and where we're at on the curve and what we started to do in Oklahoma, I believe we're doing exactly what we need to be doing. We obviously we want to get these cases down to 0, and that's obviously our number one goal. But we know that this virus is in the United States, it's in Oklahoma. That's why we really focus on the hospitalizations, the treatments, giving the hospitals exactly what they need, giving our education community exactly what they need to keep their teachers and students safe. And I just applaud how Oklahoma's done it. We're at a really good spot right now, and we're going to continue to keep this message up. But we've got to take personal responsibility. That's why we said this 5 times in the press conference. You've got to wash your hands, watch your distance, and wear a mask when you're around others.
Can you talk a little bit about your personal growth and development on the topics of how to deal with coronavirus? I mean, if we go back, when was that, June? Was that 9 months ago? Whenever that was, you go to the Trump rally. Today you're wearing a mask. You've been wearing a mask at places. Trump rally in June, you were not. And you were not in these press conferences. Heck, I wasn't. So can you talk about your growth on the issue of masking and other issues over this last few months?
Yeah, sure. We're looking at the data. We've seen some compelling data that some of the cities and counties that have mask mandates have seen a drop in their positive numbers. Those are encouraging, and so we're trying to model the best behavior for Oklahomans. And again, the other thing that I try to remind Oklahomans is we have been, back in March, their whole goal was to protect hospitalization, protect PPE, protect our healthcare workers, because the early predictions were that we were going to run out of hospital capacity. Everybody remembers that. The whole goal was to flatten the curve. So we spent a lot of time building that capacity in hospitalizations. That's why one of my executive orders was to remove elective surgeries and back those out to create the capacity in the hospitals. That's also a lever that we could pull again if we ever started running low on hospital capacity. Right now, I'm really pleased with the numbers and where we're at in the capacity, that delta between the beds we have and the people that are being treated across the state. So we're in a good position there. We've had about 1,000 cases bouncing between 700 to 1,000 or so for the last 14 days. I think we're around 11,500 active cases, so a little under 1,000 a day, and we have 516 people in the hospital. So to hit capacity, you guys can run the numbers, but we would have to start approaching 3,000 a day for the next 14 straight days before you can see those numbers going up in the hospitalization. So those are the things we look at. We obviously are in contact with all the hospitals across the state, making sure they have what they need as PPE And if we needed to create more capacity, we can pull any levers. And obviously, we could also slow down some of the some of the other things that are happening in our state. We're so different than other states. I think you're seeing other states starting to move more where Oklahoma is and starting to open up their economies a little bit more.
If I can just get you quickly to, you talked about masks, kind of pictures making the rounds on social media, you the local chamber of commerce mingling with a group not wearing masks. I need your response to that.
I didn't hear your question.
There's pictures online on Facebook of you at a local chamber of commerce meeting, pictures in large groups not wearing a mask. Just got to talk about that. Maybe your response to not wearing a mask.
I'm around the state. If I forgot to put this on, I don't know. People take pictures of me all the time and probably post stuff, and it's some folks that probably have a different agenda than we do. And again, I promote wearing masks. If I forgot to put it on and I was talking to somebody and somebody grabbed a picture, I don't have a comment about that.
Can I ask about stimulus funding? Congress is obviously debating that in D.C. A few weeks ago, you said you didn't think Oklahoma probably needed more coronavirus aid. Is that position change?
Obviously, we'll take free money from the feds if we can get it. But as an American and someone that is concerned about the national debt and continuing to go back to the well, I think the feds have already poured, over $4 or $5 trillion into this pandemic. And as long as states are continuing to shut down, and there's a pot of money that they feel like is flowing into their state, there's no real need to get the economy back going again. And so that's the thing that the president has to juggle. We'll obviously take it if there's a fourth stimulus package, or fifth, or whatever number they're on right now. I think it's number 4. But as far as we're concerned, we still have not got our $1.2 billion out the door yet. So we've got about $600 million out the door to our different state agencies, to the cities, the counties, the businesses that have been affected by this. And so my whole point with my response when the president and his team asked for my opinion, it's let's get this money out the door first before we go back and borrow another $2 trillion from our children and grandchildren, and then put that back out to let's see how this first three stimulus packages work before we go back to the well again.
Hydroxychloroquine, and we spent $2 million back in March or April on that, and it was a big promise then. To give an update, is it still prohibited by the pharmacies for distributing that to needy patients?
I don't know exactly where we're at. Does anybody have an update on that? Hydroxychloroquine? No.
There's not really been. Paul, can you repeat the question?
Yes, there's a big push back in the spring on hydroxychloroquine. We spent $2 million out of the CARES Act to get a supply in here, and there was prohibitions on some pharmacies on the actual other uses of it. Do you have an update on that and what the current status is?
So I have no update on the distribution per se. However, from a medical standpoint, hydroxychloroquine has fallen out of favor. It has fallen out of favor because there are several well-designed, randomized, controlled, and some of them are placebo-controlled trials that show it does not work either to treat or to prevent COVID-19. Now, there may still be some niche for it, but it just hasn't come to the forefront yet. So right now, the Infectious Disease Society of America is recommending against its use for either treatment or preventative purposes.
Do you know what's happening with that stockpile? The $2 million dollars that just kind of hang out somewhere? Or?
That's a great question for Commissioner.
It is, yes, we have it stored. We have, it's basically stored at this time. We're looking at different options.
Governor, the Department of Corrections is fighting multiple outbreaks right now, too, that were just recently identified. And they have reported now 5 deaths probably related to COVID. What are they doing? Do they need to be doing anything additional to stop the spread of COVID in prisons? And then additionally, will they at some point come out and brief us on what they're doing? I don't think we've seen in the DOC official one of these briefings for quite some time.
It's a great idea. We'll get them at the next briefing to give you an update on it. I know early on, we were one of the first states to stop visitations to our prisons. So we did I was really pleased early on with the limited number of positive cases that we had across the state. We were kind of the national leader. Unfortunately, it has broken out in a few prisons across the state since then. Veneta, for example, has 201 positive cases. The thing that's, if there is a positive out of the 201 positive cases, it's that 99% of them were asymptomatic. There were only 2 showed any kind of symptoms whatsoever. So we're all over that issue, but it's a great idea. I'll bring in Commissioner Crow. I know they have a strong plan. They have plenty of PPE. We've been masking up. We've been limiting the group gatherings in the correctional facilities for some time, really for this whole time. But that's the tricky thing with this virus is it's hard to stamp out completely, and you can see this in other states and what we're doing. But I'll bring in Scott Crow specifically to get back with what they're doing. Eddie Warrior, 668 have already recovered, and I think they have 113 still active cases in their prison as well. So again, I think it's something that the news media really want. We need to be focused on the active cases, because this cumulative number, if you keep adding on from March and April and May, and you keep throwing, I had COVID, you keep throwing me into the cumulative, that's a little bit, that scares the public. It scares people thinking about 75,000 where we're at today. Next year, we're going to have a cumulative total that's higher than it is today. So really the focus that I have, I look at that data, the cumulative total, I look at the positivity rates, but we also look at the percentage in hospitals, and we look at the number in hospitals, and we really make sure that we're protecting that. And at this point, we really have a really flat curve on the hospitalization. And that's due to the hard work of our medical professionals. It's also to some of the remdesivir that we're talking about, some of the new treatments. And I don't know if you caught this, but the thing that we were pleased with is 14 days was the average stay early on in April and May. And now we're down to less than 5 days. And there's multiple things that go into that. It's the age maybe of the population that's getting it with the schools reopening. You've got a lot of younger people that are just simply asymptomatic that aren't being affected by this disease. But still, those are good facts that the health professional is doing a better job in learning how to treat this.
Yeah, just one quick question. A lot of good news here, but in that White House report, they did rank Oklahoma the 5th highest rate in the country for 100 new cases per 100,000. I just wanted to get your thoughts or response on that.
Yeah, there's tons of ways to look at those positive cases, and when I saw that, I certainly was calling our health department to find out where they're getting that data, because I would encourage the media, and especially the Daily Oklahoman that printed that today, to look at Johns Hopkins, because that's the positivity rate that we track, and we're nowhere close to number 5th in the country. So that's one thing that we're going to make a phone call to the White House to find out exactly where they're getting their numbers. But I would encourage the media to look at the Johns Hopkins positivity rates, has us much lower than that. But we look at that, and if you think about the positivity rate, that's all that tells you is how many tests are taken and how many are positive. And so really, there's multiple things we have to look at, and that positivity is one thing. But that also can be manipulated a little bit with when you're driving more specimens taken especially through just asymptomatic people across the state. You also have to remember, I think it was right after Labor Day that we added in the antigen tests. Before, those were all in a different category. We've just since added those into our positivity cases, and we've had those as, what were they? How did we classify those? Probables. Those are probables up until we changed some methodology, because the antigen tests, remember, we've sent out 200 antigen kind of fast tests to our nursing homes across the state to make sure that they have exactly what they need to be able to test their population within 15 minutes. We're getting more of those out, so we need to bring those antigen tests into our positivity numbers.
Thanks, everybody. Good.